Hi, I'm Dr. Brian DeLay. I'm a sports medicine specialist focusing mostly on knee and shoulder arthroscopic and reconstructive surgery with a special interest also in fracture care. I chose that because of a lifelong interest in athletics. From the time I was a young child, my family was very involved in sports and athletics, and I had an opportunity to participate in professional and college athletics as far as taking care of those athletes during my residency, and that really fostered an interest in that particular group of patients in the field of orthopedics.
Dr. DeLay and I work kind of hand in hand. When he's in surgery, I'm typically in surgery with him as a first assist. So I'm an extra set of hands for him, doing whatever we need to do in surgery together to make each procedure go a little smoother. In the clinic, we work kind of side by side. I typically see individual patients on my own while he's seeing his patients.
I think what's most important in providing patient care is understanding what the patients are seeking when they come to our office. If they're seeking a solution to a problem, we're going to try to meet and provide them a solution to their problem. If they need time to understand their condition, we're going to provide them time to understand their condition. If they just need to comprehensively be able to rehabilitate their problem, we have that at our office as well.
I went to Lake Norman High School, played football there all 4 years, and always knew that I wanted to play in college. That was a goal of mine. Thought I had the ability and the skill and everything. Junior year, training for the upcoming season, I started having a lot of pain in my shoulder. Just tried to push through it, different treatments you could do, and then finally ended up seeing Dr. DeLay.
We diagnosed him with a posterior and superior labral tear. Through the comprehensive surgical arthroscopic procedure, he was able to participate in physical therapy and return to his high level of sport participation.
Once it was repaired, I went through the therapy and got back on the field, and I never really had a lot of issues out of it, so definitely feel confident in it now.
One of the best things about working with Dr. DeLay is he's very personable and friendly and takes the time to explain things to patients when they don't understand and make sure that they don't have any further questions.
Communication between the surgeon and patient is paramount to the success of the experience. Whether the success includes surgery or not is not necessarily of critical importance. What's important is that the patient in OrthoCarolina understands that they have an immediate access either through our direct triage line with our nursing staff or through their patient portal where they can communicate directly with me through email and get their questions answered. That communication is critical for them to have a good experience with OrthoCarolina.
He's going to be honest with you. If you need surgery, he's going to tell you. If he wants to try physical therapy or other things first, then he's going to do that. He's very knowledgeable when it comes to shoulders and knees. I mean, he can do everything. Both of my parents had shoulder surgery with him, so that's how much I trusted him.
What I enjoy most about working at OrthoCarolina, particularly in this office in Huntersville and Mooresville, is the camaraderie with the staff and my other colleagues. I'm able to walk around the corner and ask any of my partners a question about a patient that I have or answer their questions. I feel that we work together as a team so well here, and that's a team not just of the physicians, but that's the front office staff, that's the nursing staff, that's the physical therapist. You can't imagine how many times I walk through physical therapy, which is right here on site at Huntersville, and see my patients with my therapist, and we're all working together to the same goal, which is return that particular individual to a healthier, less painful life.